As Americans are ordered to stay home to curb the spread of COVID-19, telemedicine is becoming key to patients receiving care without threatening the health of others. One America's Jenn Pellegrino speaks with an emergency room physician, Dr. Jonathan Baugh, to learn more.
Dr. Jonathan Baugh, thank you so much for joining me today. I understand you're the Chief Medical Officer and co-founder of Remote Health Solutions, a telemedicine company. You're on the front lines of the telemedicine side of fighting the coronavirus. Tell us a little bit about how you're working to, working with patients right now.
Yeah, thanks, Jen, for having me on. I appreciate it. I think I'm in a unique situation where I get to work on the front lines in two ways, and that is I'm still a practicing ER physician, so I work in a level two trauma center in the ER, and then also as the co-founder and the chief medical officer for Remote Health Solutions, we really are on the cutting edge of taking care of patients for COVID-19. One of the ways that we have been doing that is by being able to take care of patients in their home. One of the things that we've done previously, we sort of have two branches of our business, and one has to do with the Department of Defense, where we supply devices to the military, and the other is where we deal with chronically ill patients, Medicare and Medicaid patients in their home, and we use our technology, our devices, to be able to send home with them, to be able to monitor their vital signs on a daily basis. We have those stored on the device and sent to our cloud, and then we respond out to those alerts to be able to improve outcomes. That was an easy transition for us to be able to start monitoring COVID-19 patients.
How many patients are you seeing right now? You must be seeing an increase over the last few days.
Yeah, I'm actually pretty lucky in the sense that I'm not in one of the big epicenters. I'm not in New York. I'm not in California. Where they are seeing dramatically high numbers, and I have friends that are in both places that really are getting overran. We're in the sort of the tail end of that, and what I think that what we're doing now is we're moving towards where they are. We will be in a week or two. So we're seeing increased numbers every day, but at this point we're not overran, but we are seeing that increasing numbers of suspected and positive patients every day.
And what are you seeing in terms of the outcomes, Dr. Baugh, both online and then in the hospital setting?
Yeah, we're seeing a wide range, and this is what we know. We know that 80+% of patients who get COVID-19 are going to have mild or no symptoms at all. They're going to be asymptomatic, and then they're going to have about 15% of those patients who have some symptoms, who are ill but recover, and then 1 to 2% of patients who are going to die. Hydroxychloroquine coupled with azithromycin seems to be the best thing that we see out there right now. And while we have had some of those used even locally, what we need more data. And so it's being used across the nation because there's little downside, there's little negative effects for those two medications. They're very widely used already, but they are hopefully showing improved outcomes. We hear and we see some dramatic results now, and we hope that we can improve that over the next few weeks.
Where do you think we are in terms of, what you're experiencing so far, what you see happening across the country in terms of getting through this?
I'll be honest, I think that we've got a ways to go. I know that there is a hope and a desire that we can quickly turn this around, but I think what we are actually seeing is those number of infected patients and the number of people who are getting dramatically ill is just increasing right now. I think that we're still a ways out from being able to be through this.
Dr. Jonathan Baugh, stay well. Thank you for all you're doing out there on the front lines, and we really appreciate you joining us.
Yeah, thank you, Jen. Appreciate your time.
Straight ahead on One American News, if you're traveling soon,